someone who has a pretty extensive concussion history, diagnosed, not diagnosed, what can I try to do to prevent diseases such as CTE? Now, we don't really know a lot about CTE. The media has us believing that there's a lot of information on CTE. It has us believing that CTE is a fact. If you have concussions, you're likely to get CTE, and that's actually not necessarily true. What CTE is, it's chronic traumatic encephalopathy, and as far as we know, it's a neuropathological condition that can only be diagnosed post-mortem. So after someone dies, we can take a look at their brain, and what we're looking for is something called tau protein. Hyperphosphorylated tau protein is found in a number of different conditions. The classification of this type of disease is called a tauopathy. And I think there's about 20 different types of tauopathies. Alzheimer's is a type of tauopathy. So tau can accumulate in the brain for a number of reasons. We don't really know why necessarily for all of those reasons. One of the theories, and I'm going to say that, one of the theories is that head trauma or repetitive concussions may be a reason that tau starts to accumulate in the brain. But there's also a number of different reasons why tau can accumulate in the brain. For example, opiate medications are known to cause increased tau deposition. How many NFL players and former athletes are taking opiate medications on a regular basis? There was a study that was done that found that more than 70% of NFL players, former NFL players, considered themselves abusers of opiate medication during and after their playing careers. So how much does that weigh into the cause or why there's tau protein inside the brain, right? So all we have right now is a group of people in what's called a case series, which is actually the lowest form of scientific evidence that we have because there's no controls, right? We're not looking at healthy people. How many former non-contact athletes might have CTE in their brain because maybe it's not due to contact at all. Maybe it's due to something else. Maybe it's a genetic variant that normal people have. Maybe up until this point it's been considered to be Alzheimer's disease, and so every time we found it we said, yeah, there it is, it's Alzheimer's. But maybe it's the same patterning as we see in CTE. We haven't done enough research yet on the general population to know the only defining thing is head injury. So when you're talking about the concerns around CTE and things you can do to prevent CTE, we don't even know if it's caused by head trauma. We have no causal link between head trauma and the pathophys or the pathological findings of what is CTE. So we don't even have that link. Secondly, we don't even have the link that the tau protein that we're seeing inside the brain actually results in any type of neurocognitive impairment in life. For example, studies done on Alzheimer's disease find that about 50% of the time, so literally half the time that they think people have Alzheimer's in life, when they actually open up their brains after they die and look for signs of tau, they don't have any at all. Then you have the reverse happen, where you have 50% of the time, if you look at a brain that didn't have signs and symptoms of dementia or cognitive impairment in life, 50% of the time you open up that brain and it has tau protein inside of it. So how can we then assume that tau protein is the cause of the symptoms that people experience? The symptoms that people are experiencing with CTE are very non-specific, right? Things like depression, rage, anger, suicidal ideation, okay? These are all things that are also present in things like depression and anxiety disorders, okay? Mental health is a very complex thing, okay? You can start to have mild cognitive impairment and things like that because of anxiety, right? There's a lot of things that lead to this feeling that you can't focus, and that could be completely related to mental health. One of the most depressing times in someone's life is retirement at any age. So if you take somebody who's in their 60s and they're 65 and they're about to retire, that's a big life change. That tends to result in an increased rate of depression. Now, if we take that and we dial that back and we put that now into a professional athlete, and now that retirement is happening at age 28, and they've retired potentially due to injuries or whatever else, how much is that going to cause depression? And how much of that depression is then going to lead to the rage, the anger, the inability to concentrate, the suicidal ideation, and all that stuff. But everyone looks at it and says, this is due to concussions, or this is due to head trauma, and we actually don't have that link established at all. This is very early stage research, but it sells papers. It sells headlines. It sells ad revenue because people click on it, because people are interested in it. When you actually read the research on it, it's really not that cut and dry. Example, large study, again, not large in number, but large in volume in terms of what they did with these athletes. University of Buffalo, they did a study. There was 21 former NFL and former NHL athletes. Mostly NHL, not so much of the NFL, but mostly NHL athletes, and they were compared to 21 non-contact athletes of the same age, sex, ethnicity, etc. They measured them. This actually got lumped into 3 separate studies because there was so much involved in what they did. The first study was looking at mild cognitive impairment. The second study was looking at executive function and mental health. The third study was looking at advanced brain imaging findings for a whole bunch of functional findings within the brain. So this is looking at people in life. The most we have right now is somebody who's died, we have their brain, and then we ask their family, well, how were they in life? Oh yeah, they were starting to lose it at the end. But we know that next of kin reports are really not that good. And so they had these players come in, and I'll just go through kind of how they did this. So they contact the alumni associations. 27 former athletes volunteered for the study. 22 were included, however, only 20 completed all examinations. They then had a control group of non-contact athletes. Their research team was divided into 6 groups to try and figure this how to do this study. 1 was the assessment of lifestyle, nutrition, smoking, drug and alcohol history, and physical activity. 2 was physical health, looking at physical examinations, sleep, and pain. 3 was psychological assessments, depression, anxiety, mental health, executive function, aggressiveness. 4 was cognition, looking at memory, attention, visual spatial orientation, intelligence, verbal skills, etc. 5 was imaging, neural structures, hemodynamic, neurometabolite concentrations, etc. Number 6 was the research methods of how best to make this study work. So they had these people come in, they did all this stuff, they did all these questionnaires, they did all these cognitive assessments on these players. And what they found was the average playing career of the players was 8.5 years. The minimum requirement was they had to play at least 2 seasons of professional sports at the highest level, NFL or NHL. Contact athletes tended to have a higher body mass index versus non-contact controls. Higher education was also found in the non-contact athletes. There was no significant difference in the groups on smoking history, alcohol, or drug abuse, although the frequencies were somewhat higher in the contact athletes for a history of smoking, alcohol, or drug abuse. There was also a trend towards more frequent smoking in the former contact athletes. On physical examination, and I think this is an important finding, 18 out of 22 of the contact athletes reported sleep problems, whereas only 1 out of the 21 non-contact athletes reported sleep problems. 16 out of the 22 contact athletes had surgery due to injuries they sustained while playing, whereas 0 of the non-contact athletes had. Let's bring it back now to opioid medications, okay? Surgical, chronic pain, all of that stuff can affect your ability to concentrate. It can affect your memory because you're so focused on pain and other things. 19 out of the 22 contact athletes reported chronic pain that was confirmed on physical examination versus only 1 of the 21 non-contact athletes. Non-contact athletes were also twice as likely to participate in regular exercise and expended significantly more kilocalories per week versus contact athletes. Here's a quote: "All differences found between the groups would tend to bias towards lower cognitive functioning in the group of contact athletes. Things like having a higher rate of obesity can affect your cognitive function, and that was higher in the former contact athletes versus the non-exercise or lack thereof can affect your cognitive capacity, and yet most of the non-contacts were not exercising regularly as opposed to most of the contacts were not exercising as opposed to the non-contacts who were. And so here's the findings. Executive function. Contact athletes perceived themselves to have issues with working memory and overall rated themselves more poorly on executive function compared with non-contact controls. However, quote, objective findings of factors associated with executive function revealed no differences between the groups even for working memory. Then the study on cognitive function. The contact athletes had less education and lower IQ. Despite a broader range of neurocognitive tests, there were only a few tests that showed that contact athletes were less capable. The contact athletes were more likely to qualify as mild cognitive impairment. However, these differences were not significant. The differences appearing to be primarily related to education levels, IQ, and body mass index. On to the imaging study. We did not find any neurometabolic, hemodynamic, functional, or structural differences on MRI between the contact and non-contact athletes. Interestingly, the only difference between the groups was the presence of cerebral microbleeds, where more non-contact athletes had microbleeds in the brain versus the contact athletes, which is obviously surprising. Quote here, the athletes who are experiencing mild cognitive impairment may have more to worry about because of obesity, chronic pain, and sleep disturbances than they do with a history of playing contact sports. So when you were to control for that, it almost eliminated the differences. And so when we look at this and we have somebody who's had a history of concussions, who's now asking us the question, what can I do to prevent it? I think the biggest thing you can do to help yourself is to realize that this is not a foregone conclusion. There's a lot of evidence showing that CTE doesn't necessarily occur, or that the findings we're finding in the brain don't necessarily mean that this is a disorder that's related to concussions. And I think the more we start thinking about it as former athletes that have had a history of concussions, the more we're going to start to feel like there's something wrong with us. And if you start looking for things, like if you start thinking, oh my God, I'm starting to get forgetful, you'll start to notice it more and more and more and more, and then it becomes a self-fulfilling prophecy. And then you become anxious about it and worried about it, and then you feel like it's getting worse and worse and worse. And this could be completely attributed to mental health, anxiety, psychological well-being, all of these things. And so I would say that if you feel like you're going this way, make sure you talk to somebody who's a professional that can help you out with this. It may be a psychologist, it may be somebody who's an expert in neurodegenerative conditions and things like that. But I think the best thing we can do is realize that the evidence is not as strong as what you're being led to believe. And if you consider that fact, I think that'll help you out from a psychological perspective and potentially